We weren't taken by surprise because we all knew in the public health world it was a matter of time before things happened. And I think the thing I would say is I wish we had taken it more seriously at a federal and a national level before. We started to see cases pop up in different places. And I wish we had at that time done more education and outreach to the community. Certainly, it was limited in the scope of what we knew at that time in many ways. But I wish we had taken a more national unified approach in terms of production of PPE and protective equipment, creating a testing strategy where we didn't have to go out and face such extreme testing shortages. I still think back to the early stages where we literally had 31 test kits in a manila envelope that we had to we had to use carefully, because at that time, the original stages of this, if someone came in with COVID-like symptoms, you had to call the health department, who called the state health department, who then had to call the CDC to get approval for them to be tested. And so at those early stages, we would have benefited significantly from a national testing strategy that would have allowed us to test more people in a quicker, more efficient manner. And I think the other thing that has been tricky too, as we've continued to move forward, is in the absence of national guidelines, you have states, trying to do the best they can in terms of coming up with metrics to determine if this is a safe level to reopen or to close things. And in the absence of a national strategy, it can create a lot of confusion where you see some states taking a little bit more restrictive actions while others don't, and the cases continue to go up and down, and we haven't effectively dealt with it in a way comparable to other countries across the world who've taken more of a unified approach and have been able to drive their numbers down more successfully.